difficulty breathing, cyanosis, altered level of consciousness, irritability. There are some patients who are more prone to have complications from H1N1 than others, and so if you see the list here, this is from this pandemic studies done in the US, looking at who are the patients who are more likely to have complications, and they're listed here, the patients with chronic lung problem. If you have asthma and you are taking cortisone, for example, you're at higher risk. Cardiac disease, immunosuppression, pregnancy, and there seems to be a high risk for complication for obese patients. And I'm not talking about slightly overweight, so you don't need to go on a strict diet, but this is morbid obesity. It seems like patients who have morbid obesity seem to have more complications. And so the complications can be respiratory complications, so the patients might have a pneumonia, bronchitis, they might have otitis for children, sinusitis. Again, the complication rate, as I showed you, is 0.3%, so it's not very high. So not every patient who comes with H1N1 influenza, I'm going to have to worry about pneumonia or otitis, but it's something to keep in mind in case the patient did not progress as per your estimation. There are other complications that one should keep in mind, including cardiac, neurological, again, that one should not dismiss as, oh, not important if the patient comes and says, I have very rapid heart rate, or I have severe muscle aches, etc. So the physician should be aware that some of the complications can occur in the high-risk patients. How do we diagnose H1N1? Just one or two slides on this. Many of you have had your children tested for this. There are two ways to diagnose it, either a nasal swab, we put a cotton swab in the nose, or a nasal wash with the swab where you put clean water in the nose and then you collect that water back. And there are two tests available in Lebanon. And here I'd like to spend time explaining this. Yesterday there was an article in the journal, in one of the magazine newspaper, talking about al-mutajara test. Basically, many pharmacies now are offering the flu test for 20,000 Lebanese lira. But I'm going to say something in Arabic, they will translate, basically. So a test that costs 20,000 Lebanese lira is not, it's not even cost effective. It's something that costs 20,000 lira, it's really worth 20,000 lira. So the test that is offered in the pharmacy has a very poor sensitivity and specificity. The ones that we're doing at AUB, for example, which is a rapid antigen test, costs 108,000 Lebanese lira. And so at AUB, we refuse to get the other tests because we think they're useless. So for that test, even in the best tests, the antigen tests that are done in the major hospitals, the sensitivity varies between 40 to 78%, which means that in the best case scenario, you're going to be missing 22% of the cases. And so the one that confirms really that it is H1N1 virus, because the rapid antigen, all it tells you, you have influenza A or B. And you can have the influenza that is, seasonal influenza. So if I tell you you have influenza A, it can be the seasonal influenza. To confirm that it is H1N1, you have to do the PCR test that is only offered at Rafiq Hariri Hospital. At the beginning, we were doing it on everybody, again, because we wanted to understand the epidemic. But nowadays, we're not doing it. We do not test everyone with suspected infection. The diagnosis is made clinically. Your doctor should be able, based on your clinical findings, and after excluding other diagnoses, that this is most likely H1N1 influenza, or this is most likely influenza. And therefore, we are only performing the test on the categories of patients listed down: hospitalized, high risk, atypical presentation, and immunosuppressed. One thing I was discussing earlier is some of the teachers or schools are requesting the doctors to write, my son has no H1N1 and therefore can come back to school. I'm not sure I agree with that, because even if you do the test and it's negative, you cannot exclude H1N1, and therefore I think clinical judgment of the doctor, and it should be a doctor who is well versed in influenza and infectious diseases, that they should be able to say, okay, most likely you have this or most likely you don't, and therefore, doctors are not gods. I think all they can say is, in my judgment, the child does not have a contagious disease and therefore can go back. What about treatment of influenza, seasonal or pandemic influenza? As you know, Tamiflu is available in Lebanon. It's the only one that is recommended now and available in Lebanon. There's another one inhaled zanamivir. We don't have it in Lebanon. In the summer, I think Tamiflu sold more than Panadol in the pharmacies. I think it was overly abused in Lebanon, whereas neighbors started prescribing it to each other. Okay, what do you have, fever? Oh, take Tamiflu 5 days. It costs 70,000. Take it. If it doesn't work, it doesn't harm. And so I think here I'd really like to tell you that routine treatment for all symptomatic patients is not appropriate. And increasing drug availability to the public is going to only increase the inappropriate use of this drug and increase risk of viral resistance. There are already many studies circulating showing that a lot of the virus that is spreading in some country is already very resistant to Tamiflu. So if we abuse it in the community, when I really needed to treat my cancer patient with influenza, it's not going to work anymore because the virus is now becoming very resistant. So I put here that uncontrolled use of Tamiflu, in my opinion, may do more harm than good. Recent studies have shown that what does Tamiflu do to your patient? It's not like antibacterial. If you have a pneumonia and you take Augmentin, let's say, it kills your bacteria, and if you don't take it, your bacteria will progress and might kill you. That's for bacterial agents. For viruses, it's not the same. This is Lancet Infectious Diseases is one of the top journals in the field of infectious diseases, and this study was published there and showed that at best, what Tamiflu is doing is reducing your symptoms by 12 hours. That is what it's doing. So instead of having fever for 5 days and vomiting for 2 days, you're going to have fever for 4.5 days instead of 5 days. So what I'm trying to say is, in people who are healthy, a good immune system, etc., we're no longer prescribing Tamiflu to. Obviously, drug companies and pharmacies, etc., there is a lot of urge to spread the news that use more Tamiflu, it protects you, it prevents you from dying from the virus. But in reality, the scientific evidence does not suggest that. So only recommended treatment for people at risk, and when you decide that this particular patient needs to be treated, the earlier you start treatment, the better. And that's why waiting to get a confirmation of a PCR test from Rafiq Hariri Hospital after 5 days is not going to help you. If you think you have influenza and you are a candidate for treatment, start it immediately. So this is what the CDC advised October 19. This is very recent. Clinical judgment of the physician should be the ultimate guide on making recommendations. And so this is what they list as the people who need to be treated. So if your child or yourself belong to one of these categories, then you would say, okay, I'm going to take Tamiflu. If not, then maybe it will not do any benefit. Now, I put here important questions that I get asked by my patients a lot. What are the warning signs in children? If your child has any one of the findings listed here, then you really need to see your pediatrician immediately. Fast breathing or rapid or trouble breathing. If the child becomes blue or has a gray skin color, not drinking fluid, severe or persistent vomiting, not waking up or not interacting, so irritable, does not want to be helped. Or if the patient